Namaskar, I am Dr. Ranjan Gupta and I welcome you all to another episode of IRA Legends with my colleague Dr. Shashank Akerkar. Today, we are going to listen to the story of another eminent physician and another pioneer of Indian rheumatology who, with his efforts, established not just one or two but a total of three departments within India and abroad. We welcome Dr. A.N. Malaviya with us for today's episode. But before we listen to his story and experiences, we would first go through his journey through some of the pictures. We must be having so many questions in our mind as to how he landed up in Boston, how did he come back to India, why did he join AIMS New Delhi, and what he did there, and how did he do all these things. Let's try to get answers to some of these questions.
Professor Anand Narayan Malaviya was born on 27th November 1939 in Azamgarh district of Uttar Pradesh, where his father was posted as an inspector of schools. Since he was in a transferable job, Dr. Malaviya stayed at various places of Uttar Pradesh before getting admission into MBBS at the prestigious King George's Medical College of Lucknow. After completing his MBBS in 1961, Doctor Malaviya joined MD in internal medicine at the same institute. While pursuing his post-graduation, he got interested in immunology. In 1964, he left from India for Boston to study immunology there. Professor Malaviya got married to Mrs. Rekha Malaviya in 1965. In Boston, he joined the New England Medical Center under the mentorship of Dr. Tenenberg and Dr. Robert Schwartz to study clinical immunology. Under the guidance of Dr. Robert Schwartz, Dr. Malaviya became the first person in history to use methotrexate in the treatment of dermatomyositis. Their observations on the use of methotrexate in dermatomyositis were published in the journal Lancet in 1968. The same year, Dr. Malaviya published another seminal paper on the life cycle of antibody-forming cells in the Journal of Experimental Medicine. Dr. Malaviya spent almost 4 years in Boston learning clinical immunology. Dr. Malaviya returned to India in 1968 and joined as a faculty member in the Department of Internal Medicine in the then newly established the All India Institute of Medical Sciences, New Delhi. He joined hands with late Professor Ramesh Kumar of the Department of Microbiology, who helped him in growing Crithidia in the lab. Professor Uday Bhuiyan, who was one of the first renal pathologists of India, helped Dr. Malviya develop slides using rat liver for testing ANA by immunofluorescence. Professor Narinder Mehra of the Department of Transplant Immunology and Immunogenetics helped Dr. Malviya carry out the work related to HLAs. Laboratory technicians Mr. Gopal Singh and Mr. Sube Singh helped Dr. Malviya setting up the clinical immunology laboratory under the leadership of Chief Technical Officer late Mr. Romesh Taneja, who is remembered as Man Friday for AIMS Clinical Immunology Laboratory by Dr. Malviya. Dr. Malviya fondly remembers getting handmade incubators from the Chandni Chowk area of Old Delhi and making handmade plexiglass ANA slide washers and electrophoresis chambers. The reagents, including the mouse liver, for doing immunofluorescent antinuclear antibody tests were all arranged in-house. Goats were used for raising monospecific antisera for immunofluorescence. Doctor Malaviya was trained in indirect immunofluorescence testing for ANA by the father of this technique, late Professor John Holborough. Within 2 years of his joining the AIMS New Delhi, Dr. Malaviya became the first person in India to perform fluorescent antinuclear antibody testing in 1970. He also established in-house indirect immunofluorescence testing for anti-dsDNA antibodies using Crithidia, ANCA, antimicrosomal antibodies, and antiparietal cell antibodies. Not just indirect immunofluorescence, but the first ever ELISA in India for antiphospholipid antibodies also was performed in Dr. Malaviya's lab in 1978 by the then mentee Dr. Ramnath Mishra. Taking advantage of his hands-on training in various laboratory techniques at Boston, Dr. Malaviya also established other assays at the Clinical Immunology Laboratory of Ames to diagnose conditions like dysproteinemias, immunoelectrophoresis for myeloma detection, in-house tests for B and T cell counting, and devising polarized microscope for synovial fluid examination to diagnose crystal arthropathies. Dr. Malaviya calls himself lucky to have been mentored by the masters of rheumatology like late Dr. David Cohe and Sir Ravinder Maini. Dr. Malaviya gave the first clinical and immunological characterization of various rheumatic diseases from India. His study on the prevalence of systemic lupus erythematosus in India, published in Lupus in 1993, is one of the most quoted studies on the topic. His pioneering work for other rheumatic diseases is also notable from India, like rheumatoid arthritis, systemic sclerosis, Sjogren syndrome, inflammatory myopathies, and spondyloarthritis group of diseases. Among the rarer rheumatic diseases, he has given the first account of vasculitis group of diseases, sarcoidosis, relapsing polychondritis, multicentric reticulohistiocytosis, gonococcal arthritis, and primary amyloidosis. He has more than 550 international publications and numerous book chapters to his credit. After taking voluntary retirement from Ames, Dr. Malaviya moved to Indian Spinal Injury Center in New Delhi, where he established the Department of Clinical Immunology and Rheumatology. Many of his students from India are well-known names in the field of clinical immunology and rheumatology in the world today. Not just within India, he has also inspired students outside India to pursue clinical immunology and rheumatology as their career. Several Indian agencies, including ICMR, have awarded him for his achievements in the field. He was awarded the Master Award by the American College of Rheumatology in 2006 and by APLAR in 2015. Dr. Malaviya loves singing and he has received formal training in Indian classical music. He is an avid runner even at the age of 84 and doesn't like to miss his running session in the evening even for a day. With his hard work, Dr. Malaviya established a total of 3 departments of clinical immunology and rheumatology within India and abroad, including the one at the Indian Spinal Injury Center, where he is currently practicing. Dr. Malaviya gives all the credit of his success to these 2 persons. First, to his mentor Dr. Robert Schwartz, and the second, to his better half, Madam Rekha Malaviya. We thank you, sir, for continuing to inspire us.
This is the very first thing that everybody wants to know is that a young and a brilliant physician who is just passing out of KGMC decide to take pipettes in his hand besides the stethoscope.
This is a very interesting question. I'll tell you. Let us go back in time to year 1962. I passed out MBBS in 61. 62, 63, I was doing the residency. And in Lucknow Medical College, attached to the ward was a clinical pathology laboratory. And a demonstrator from the Department of Pathology used to rotate. I started working up my patients with general medicine, and I found that if I can do some CBC, ESR, etc., and urine test and stool test, the whole thing becomes solid. My diagnosis is different. I said, this is anemia. Can I demonstrate ankylostoma in this stool? And the professor in the morning will come and I'll show you, sir, look at this. I started doing that, and my demonstrator, Dr. Yadav, was there. He took keen interest in teaching me many of these small things in the laboratory, including how to hold a pipette, how to suck it and not ingest it. So this is how we started. And as luck would have it, that was also the year, just a year and a half before that, there was a Nobel Prize in Physiology and Medicine to Sir Macfarlane Burnet of Melbourne, and what he said was clonal selection theory in immunology, which all of us read and got very excited. And corollary to that, that theory was proven by Sir Peter Medawar from Mill Hill, London, and both of them, they shared the Nobel Prize of Physiology and Medicine. And you can imagine a young person like me, interested in laboratory plus the clinical, this Nobel Prize making splash news all over the world. I said, well, immunology is some very interesting subject. And another beautiful coincidence, Lancet, major paper by J.F.A.P. Miller from the same institute as Sir Macfarlane Burnet in Melbourne. Topic, thymus and immunology. All of us, especially Sarkar, my colleague who stood first in the class, I was second anyway. We all read that and we all, well, this is the latest. This is immunology. And that triggered me, and my professor and my guru, late Professor Kulbhushan Kumar, genius in medicine at KG Medical College, Lucknow. He gave me a topic, seminar topic for the departmental seminar titled Lesions of Autoimmunity, written by Baron Waxman, who was the chief of immunology at Yale University in USA. After all that, the only thing was, the hurdle is pass your MD medicine, which I did, of course. And the moment I did that, I went to the head of the Department of Medicine, Professor S.S. Mishra, sir, I'm leaving. You are leaving? Who? What happens? Senior residency, which will all fall vacant. I said, sir, I'm going to America to learn immunology. He said, you are going to America? Okay, my best wishes. And here I was. I hadn't gone out of Lucknow alone. I sat in a train, came to Delhi, and my father said, please be careful, you're traveling for the first time. You know, from small cities, Allahabad and all that. I came to Delhi, my Mamaji was here, he took me to Palam Airport, which was a small village with tin roof, and his plane was standing to take me to Boston. And here I am reaching Boston at 2 a.m. in the morning. And that is really beautiful. It tells about the American attitude to those who want to learn. Next to me was sitting somebody from Boston, from New York to Boston, small flight, just for 45 minutes. He says, you are from? I said, I'm from India. Where are you going? I said, I'm going to such and such hospital. He says, from airport, how will you go to the hospital? I said, I'll take a taxi. You have any money? I said, I have $8 in my pocket. He said, $8? You will not be able to reach your hospital. And can you believe it? He took my whole thing and he dropped me at the hospital and said, this is a new doctor, look after him properly. While working there, I came across a senior person, a consultant. He says, you are from India, what's your interest? I said, I want to do immunology. He said, immunology of what? I said, lupus and rheumatoid. Why rheumatoid? Because I treated rheumatoid, and in those days there was hardly any treatment for rheumatoid arthritis. And I was very interested. Looks like an immune system, because rheumatoid factor had been described just before that. He says, I'm a rheumatologist. I know a rheumatologist in Boston. I will take you there. You are wasting time in this peripheral hospital. And that's it. I went to New England Medical Center and joined legendary immunosuppressive people, William Damashek, and Robert Schwartz. Late Robert Schwartz was my teacher, my mentor. I am whatever I am today because of him. That's the story of me becoming an immunologist and rheumatologist. I will tell you many more things about it, but this is how it started.
So, sir, in an era when AIMS New Delhi was not in existence and nowhere in India we had a department of rheumatology or immunology, how did you land up with rheumatologists and immunologists in Boston?
This is also a very interesting story about it. When Dr. Gowans, who was the rheumatologist who saw me in a peripheral hospital, and when I spoke to him that my interest is rheumatoid and lupus, he said, I'm a rheumatologist and I will take you to Boston and you can then be under specialists and big people. They will teach you all that. When I joined there, the name was Robert Schwartz and William Damashek. These two people had written in 1962 and 63 two major papers that changed the whole world of organ transplantation. Very few people will remember them. They were the first one to use chemical immunosuppression for allotransplantation from one strain of mice. They will take the skin from black strain of mice and put it on the white strain of mice and chemically suppress their immune system to a degree that the recipient of this black skin, the recipient mice strain, will accept it. And thus they became the father of immunosuppression, which was supposed to be chemical immunosuppression. Before that, the only thing which used to modulate immune system to some degree was the Philip Hench's discovery of glucocorticoids. But glucocorticoids couldn't have been given for a long time. So when I joined them, I said, here is the place who is doing immunology, as well as the persons have become so famous. So I joined that department, and as luck would have it, another person joined that department who was interested in pure hematology. So Damashek and William Crosby became hematologists, and Robert Schwartz said, I will do only immunomodulation, immunosuppression, and immune-related diseases with systemic lupus as the main disease that I will be doing research. And now Robert Schwartz, a young, dynamic, brilliant young physician, associate professor of medicine in the Department of Medicine, doing hematology, but discoverer of chemical immunosuppression, interested in lupus, along with a person, Dr. Lewis, who had a whole group of dog lupus. They were working together, and when I joined, they said, what's your interest, Anand? I said, immunology and lupus. He said, you are at the right place. And thus I became the first fellow of Robert Schwartz. Remember this name, fellow of Robert Schwartz. I take pride in saying I was the first one. Eisenberg, the famous rheumatoid David Eisenberg, is the 12th, and Yehuda Schonfield is the 8th. I was the first fellow of Robert Schwartz. That's how I got involved in basic research, cell cycle, how to label cells, setting up anti-nuclear antibody, setting up rheumatoid factor testing. All these antibody testings were being done in Schwartz's direction. And Linda was the technician who was learning how to do it. And Anand Malaviya as a fellow, half the time working up the patients of lupus, the rest of the time learning from Schwartz directly how to hold the pipette, how to raise the antiserum, how to label the gamma globulins for immunofluorescence, how to do radioisotope studies. And at the end of 4 years, I became a master in doing anti-nuclear and other autoantibodies. I was able to do laboratory experiments like regular, well-trained laboratory persons. I will handle mice experiments without any difficulty. And at the same time, I will be taking the history and doing physical examination and describing in a clinical grand round how the lupus looks like. This is the training I got. Right there, one other thing I would like to tell you. While we were looking at lupus, the issue was kidneys are getting involved. What to do with that? Damarshek said that Bob is Robert Schwartz, his assistant. Bob, the nitrogen mustard is being used in cancer. Can you use a small dose of nitrogen mustard and give it to lupus and suppress their immune system? Do you know? It used to come as a gas in a sealed bottle. We will put some liquid in it, saline, shake it quickly and put it in the running IV drip and give it to the patient with systemic lupus, kidney involvement. That's how it started the mustard treatment of lupus nephritis. Very soon we had cyclophosphamide. And that's where we learned to give cyclophosphamide for treatment of lupus kidney. Now, this is the story, and that then it went to the NIH, they did the studies, NIH cyclophosphamide regime, but it all started at New England Medical Center with Damashek and Schwartz's mind of using chemical immunosuppression for modulating the immune system, not suppressing it, modulating the immune system for the benefit of the patient. This is how I got involved with the whole thing. And one little story. Anand, there is a patient in the outpatient, rush there, she is in trouble, work up, and I'm coming to, you present the case to me. That's how they used to teach in those days. Robert Schwartz knew all the patient, he knew everything, but I don't know, somebody is there, you go and work up. I went there and a lady sitting there, I can't get up from the chair, I can't make my hair. I said, okay, it sounds like, what did I study in MD? Proximal muscle weakness. There is a disease called inflammatory myositis. In those days, we used to call it dermatomyositis. So I started looking. I didn't find much, but yes, she had proximal muscle weakness. By then, Dr. Schwartz came. Anand, present your case. I said, Mrs. Horn, her name still I remember, Mrs. Horn. She is this. She is on treatment. She has been given glucocorticoid, the new drug, which is in vogue nowadays and all. She feels a little better, but there is nothing else. The Schwartz looked at her like that and said, Anand, go back to Lucknow. You don't learn anything. So what happened, Dr. Schwartz? Nobody ever called sir. What happened, Dr. Schwartz? You have missed everything here. You have missed the rash on the cheek, which is crossing the nasolabial fold. In lupus, it never happens. Look at the V sign here. Look at the swelling around the eye. That's how I started learning connective tissue diseases. The rest is, as I say, is a story, which I keep telling till now. And when I came back to All India Institute and I said, when I joined, that itself is a story I will tell you. The director, the legendary physician who was treating Jawaharlal Nehru, he says, hey, where have you been? We have been sending letters. You should have come earlier. I said, I didn't know I'm already appointed. He says, what do you do? I said, I look after lupus patient. It doesn't occur in India. I have seen in my life 6 cases. So you better, I'm told you do some laboratory. That fellow, Ramalinga. What is his name? Ramalinga Swami. He is in pathology. He will teach you some laboratory. You go and start the laboratory. That was the story. I can expand upon it if you ask further questions. How I landed up in All India Institute, that itself is a story.
So, sir, how in those days when you were in US, how did rheumatology and immunology look like, and where did this concept of clinical immunology come from?
This also has a very, very interesting story. As I mentioned, it was basically a department of hematology where William Damashek had written the book on leukemia and hematology. Robert Schwartz was hematologist, but his interest was lupus and immunomodulation, as I just mentioned. And Damashek and Schwartz and Damashek have already written chemical immunosuppression using 6-mercaptopurine as the drug, or that helped in allotransplantation of organs. Now, Robert Schwartz therefore wanted to get a separate section within hematology so that he can pursue his interest of immunomodulation. So he talked to Dr. William Damashek, and Crosby came as a pure hematologist. So Schwartz was then given a separate section. Now, what name to be given? His interest was only lupus. You can't make a department of lupus. Then people said, this is part of rheumatology. Rheumatology in those days consisted of only aches and pains in the knee joint and some deformed rheumatoid for which there was no treatment. So Short said, no rheumatology. Now, what name to be given? Clinical immunology. And that name, clinical immunology, picked up, and interestingly, four other places in America soon after that, clinical immunology and rheumatology. And in Europe, 15 or 12, I don't remember the number, within the next few years, clinical immunology, rheumatology, or rheumatology or clinical immunology departments started. So the originator of this term, clinical immunology and rheumatology, the brainchild of Robert Schwartz. And this is what I started when I came back. But let me tell you about Schwartz's story. So we will have, in a week, we will take round, and by then lupus, of course. But then once you start doing connective tissue diseases, you will start getting Sjogren's syndrome, you will start getting scleroderma, you will start getting dermatomyositis. So all those diseases started coming to us, and I mentioned about this lady, Mrs. Horn, the first case I saw there of inflammatory myositis. So it became clinical immunology department which deals with connective tissue diseases. And all the 4 years that I stayed there, I learned about all the connective tissue diseases, nothing to do with pure rehabilitation, which was the main theme of rheumatology in those days. So I was zero in physical therapy, I was zero in physiotherapy, occupational therapy, didn't know a word about osteoarthritis. Immunoinflammation is the name, and this name also was given by Robert Schwartz. Of course, it is said that Seligman was the professor of immunology in Paris. He was doing work in lupus. He used to give this name in French, inflammation, something in French. And then it was translated by Robert Schwartz. This is immunoinflammation. So I picked up these two things, clinical immunology and immunoinflammation. These two words have become now popular in India wherever there has been some influence of mine, or at least they are in touch with me. During that time, therefore, I did two types of work. One in the basic laboratory, where I studied the life cycle of antibody forming cell. And I'm talking of 66, 67, 68, when B cells and T cells were not known. What cell makes antibody? And that paper went into Journal of Experimental Medicine with highest rating in medical journals. That one paper. And my second paper was on clinical. On what? A drug which was used by Yella Pragada Subbarao for treating in the same city of Boston, in Harvard Medical School's cancer hospital, which is now called Sidney Farber Institute. There, it was used for cancer. Robert Schwartz says, Anand, use this in a smaller amount and do some experiments in mice. See what does it do in the immune system. And I was doing work with that, trying to see how it suppresses the immune system. Lo and behold, a patient came. Michael was his first name, I still remember. Admitted at night in emergency, unable to breathe. In those days, the respirator was bird respirator. Small little green thing, cut, 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 cut. And the child was unconscious. The parents were crying. In the morning round, Schwartz says, look, Michael is dying. What can we do? And then he talked to the parents. Can we do some experimental drug? Should we give him some experimental drug? Do I have your permission? Those were the days when there was no litigation, no lawyers are lurking around to sue you. Nothing of the sort. Open heart. We will do everything for the patient. Give me permission. They said, you do whatever, my child is dying. Anand, what should we give him? Should we give him a cyclophosphamide that we gave to the last patient, lupus? Should we give that drug which was called XYZ? I said, which one is that? He says, Burroughs Welcome people came. There is a new compound which works in suppressing the immune system, modulating it. I have worked on that. They wanted me to give the name. Do you know about that? I said, no, I don't remember. You didn't tell me. He says, that's the drug. They were asking for the name. I said, look, your drug is Myleran for myelocytic leukemia, Leukeran for lymphocytic leukemia. Why not give it to the name Imuran? I said, Imuran, but what is this pharmacological name? This is a derivative of 6-mercaptopurine. Its name is azathioprine. So the name of azathioprine, which became so popular by the name of Imuran, I was standing in that room when Schwartz was telling me the story, how the name Imuran came. Now that really brings me, when I hear nowadays, yeah, immunosuppressive, this drug is immunosuppressive. I burn inside. What the hell, yaar? I have learned immunomodulation from the father of those who discovered immunomodulation. And you are telling me what is immunosuppressive. Anyway, that's besides the point. That's how azathioprine had come. So Schwartz very cleverly asked me, should we use cyclophosphamide, which we gave in the last patient with lupus nephritis? Or should we give this new drug Imuran or anything else? And then he looked at me. I said, Robert Schwartz, that yellow liquid, it is called methotrexate. He says, why are you saying now? Dr. Schwartz, there is a letter to the editor against you. You mentioned somewhere its name, a methopterin. They said because of the chemical structure, those who give the name of the compound based upon the structure, they have changed its name to methotrexate. Oh, hell with them. Okay, if you want to call it methotrexate, that's okay. Dr. Schwartz, I would like to give him methotrexate. This young man from India, from Snake Charmer's country, he has magic. Do you permit him to give the drug? Do whatever you want, my child. Save him if you can. And you can imagine, the parents telling you, okay, Anand, you rush to the laboratory. What do I pick up? I was using the same vial and injecting in mice. I picked up the same vial, it's a stable compound. You can keep it on room temperature. I put the needle, sucked it. How much should I give? He says 5 grams is a bit high because 5 grams is the dose given in lymphoma. So I said, what do I do? He says, give a little lower dose. I said, okay, 200. He says, okay, give 200, maybe 100. Let us give 200. So I just picked up, pushed 200. That was the start of methotrexate as the drug for immunomodulation. What happened to the child? Next day, Michael was with his breakfast tray, eating with his own hands. It was such a dramatic pleasure. And I tell you, Schwartz said, do you know the Los Angeles group is working on amethopterin in inflammatory myositis. Let us beat them. I'm going to call all my patients of inflammatory myositis and we are going to give them methotrexate. And in the next 2 weeks, he collected 4 patients and he says, can we reduce the dose? So the second was 100 milligrams. The third was 50 milligrams. Oh, it's too low a dose. It will not work below that. But let us give 50 to the fourth one also. All the 4 improved. The paper, Robert Schwartz with his own, in those days, they were all experts typing, but Schwartz was an older generation. He sat down one night and came in the morning, gave it to, what was her name? Our lovely secretary. Quickly typewrite it. I'm sending it to Lancet. And when I read, a person of his stature, he sat down and without a comma, full stop, wrote down the whole paper in one go. It was printed and sent by speed post उस ज़माने में it was not there. So he posted it to Lancet, and after 10 days came the message, your paper is accepted. No review, nothing. Because Lancet in those days, oh, this is something. It will change the course of immunological diseases. And when I showed it to Paul Bacon, late Paul Bacon, very close friend of mine, I said, Paul, have you read this paper? I heard of this. Do you have a copy? I gave it to him. And I have given you also a copy of it. He went through and said, rather daring to give 200 milligrams. Nowadays, people say 25 milligram is high dose. I strongly object to that. That's wrong. It's lowest of low dose. And thus came the concept of high dose, a different drug than low dose methotrexate, entirely different drug. High dose aspirin, in olden days, when I joined Boston, 6 grams of aspirin was the drug to be given to treat rheumatoid. And how much aspirin we use nowadays? 75 milligram, 125, 150 biggest dose. So just like that, if somebody says 25 is high dose, I fight with them. As you saw me, I said today, this is wrong. 25 is the lowest of low. Below that, it doesn't work. Of course, when the patient is in remission, you can bring it down to 20 milligram, but below 15, most often the patient will relapse. If you have given it for 5 years, then you bring it down to 10 milligram and give it for 50 years. This drug is completely free of side effect. I mean, this is what I would like to convey. This is how methotrexate became a very favorite drug of mine. And today, for all the rheumatology fraternity, any inflammatory immunological diseases which I call immunoinflammatory, the primary drug is methotrexate. Be it scleroderma, be it dermatomyositis, be it lupus. Now, the latest guideline, 2023, methotrexate hydroxychloroquine is the first drug for lupus now. Azathioprine has gone on the sites. So this is the story, how I learned immunomodulation versus immunosuppression, which other people give, how to use these drugs, how to be confident in giving them, how to call them, they are two distinct drugs. That's a cancer drug. Don't use that term, HD methotrexate, and don't confuse that with LD methotrexate, which is what we are using. And now any inflammatory disease of systemic immunoinflammatory type, methotrexate is drug of choice. So this is what happened. These 2 papers I wrote, Lancet, Dr. Schwartz was kind enough to put my name as the first name. And thus I keep on saying I am the original user of methotrexate in rheumatic conditions. Later on in 1972 came a paper for rheumatoid arthritis by Hofmeister. Then later on, of course, the controlled trials in 1985, that methotrexate is a drug of choice of rheumatoid. My only, I should have done it. I should have also given it in rheumatoid. But time was not there because I was ready to, 4 years is enough. I must go back and serve my country. So I came back, and these 2 papers and how I came back is itself a little, I will tell you, in those days in America, there used to be a India News magazine by the embassy. On that, there was a small advertisement which I didn't see. But my seniors, Dr. Mathur and Dr. Nigam, they were senior residents and chief residents when I was doing junior residency. They were very fond of me. Anand, there is an advertisement in from All India Institute. They want immunology and allergy assistant professor. I said, what I will do is, I will bypass allergy and say I am immunology. I put the application, send it by post, and went for, with my lovely newlywed wife, I went to Europe with this little child. So I was traveling in Europe. Forget about India. So after 2-3 weeks of traveling, driving Switzerland, Germany, everywhere, reached Lucknow, at least reached Delhi. My father came to receive me. He says, you told me that you have applied at All India Institute. Why not go and check? Oh, maybe. I said, no, nobody will take me. That's a big place. Then he said, no, you go. He arranged my interview. Because I didn't know government ways. Yeah, there is something called their secretary. They will give you appointment, then you go. I was not aware of all this. My father was in government service, so he knew. So Mr. Dhingra was sitting there, chubby man. Later he became famous registrar when I joined. He says, आप कहाँ थे? हमने क्यों? अरे आपका यहाँ इंतजार हो रहा है. बहुत इंतजार. अंदर जाइए, डांट पड़ेगी. Oh my God. केलविक के बारे में सुना था. He was brought by Rajkumari Amrit Kaur, handpicked from Lahore to be the director of All India Institute after B.B. Dikshit. He was the head of the Department of Medicine. In Punjabi, ithe tusi make a Department of Medicine to Kelvik. Vik Sahab, Punjabi, he will say, Kithe, you will, in short, where were you? We have a letter for you. I said, what letter, sir? You have been appointed assistant professor here. I never came for interview. Who cares for interview? That Rama, what is it? Linga Swami, he told that you are a good man, you are a good boy, you have two very famous papers, so you are appointed. You go there is a room there, you sit there. I almost fainted. Here I am, not knowing I am appointed as assistant professor 1968, September 12th. I am on the faculty of All India Institute. The rest is a story. You can ask further questions, but this is how I came from Boston to back to India. The one question which probably you will ask, many persons in those days, they went there and stayed there. It never occurred to me that I will ever stay in America. No, I come from a very different background. My whole family has lived for the independence of India. We consider India as ours. And my great-grandfather served the longest president of Congress.
Yes, Mr. Malaviya.
So the question of me staying there, in fact, in a joking way, Schwartz said, won't you stay here? I can get you a job. And no doubt, Schwartz, India needs me. That's how I came here.
So, sir, you said once you came to India, you got comments like कि India में रुपस नहीं होता, and still you were able to set up such a successful department. Not just one, two, you set up a total of 3 departments within India and abroad. So, how did it happen, and which one was the most interesting and challenging for you?
Actually, this all started the first day when I met the then director K.L. Vig. Vig Saab said that, in my whole life I have seen 6 lupus, so you will not get any patient of lupus. But what you do is, you have worked in the laboratory also. I have a feeling that if you set up a laboratory where anti-nuclear and all these antibodies are being done, maybe the patient will start coming and your subject will then grow. Mm-hmm. So he told me that you go up and meet Professor Ramlinga Swami. He's in pathology. He knows all about laboratory, and you have worked in the laboratory. So you start a laboratory, and then the clientage will grow slowly, and you will have a department. You will have a specialty grow. So I went up and I met Ramlinga Swami. He said, oh, young man, you are back here. We have been searching for you. And then he just took me as part of pathology department.
Yes.
And half the time I was spending then in pathology, with Dr. Bhuiya doing the biopsy of the kidney and we all doing fluorescence and all that. So that was the beginning of how I started doing the laboratory. Ahuja Sahab, the head of the Department of Medicine, because Big had by then left medicine and become full-time director, and MMS Ahuja, Manmohan Singh Ahuja, became the head of the department. He also took me just like that. Oh, you are my son. And he said, go ahead and make the best laboratory in India. And he gave me the space and all the free hand. Ramalinga Swami from pathology, all the equipment you want to use, animal house, and All India Institute workshop for making instruments, because it was the day, those were the days of socialistic economy, Nothing can be brought from outside. You have to do everything with your own hand. So we started injecting the goats and rabbits, raised antisera, made conjugates, fluorescein, fluorescein conjugate we made. Dr. Ramlinga Swami gave a monocular epifluorescent microscope. We set it all up. The room number 4076, which you will be working in, you must be knowing, that's still there. That's where we set up the whole lab. And by 1971, everything in that lab was running. Professor V.R. Joshi from Lucknow and Chandrasekharan from Madras, they both contacted me, can you help us setting the lab? Chandrasekharan even sent a PhD student to learn clinical immunology laboratory work from us. And this is the story. That's how the immunology clinic started. And the name, Immunology Clinic. Why? Orthopedic said, nothing doing. Rheumatology name will not come. We deal with rheumatoid arthritis. So we were told quietly, you call it clinical immunology laboratory. That's how clinical immunology came to India. By the time Misra and others came as my students to learn this, quietly I changed the name clinical immunology and rheumatology. So Robert Schwartz gave the name clinical immunology. I took it here. When orthopedic senior people retired, I added rheumatology. And now all over India, it is clinical immunology, rheumatology, or rheumatology, clinical immunology. And this is the story. And then it attracted all the brightest of bright people, including Amita, your teacher, and Ramnath Mishra and Ramraj Singh, and the whole host of Ira Pandey, Bhaskar Das Gupta, and you name it. Ramraj Singh, who is in UCLA, professor rheumatology. And that became my field. And I feel so happy. Then we wrote papers after papers after papers. So we have 550 publications, book chapters. And then I started being called to set up laboratories and departments. Joshi Sahab was so great. He called me to Nair Hospital. Anand, you come over and help us with the laboratory, and in Chandrasekharan. So these two laboratories, I was behind those two places to start immunology laboratory. Then MCI called me to be an expert, and the first DM, Chandrasekharan's department in Madras, 1995, they started DM, and I was the person who cleared it. Then, of course, Hyderabad I cleared, and then MCI kept on sending me for different. SGPGI is a special story, Lucknow. I was on the board of directors, board of specialists, on the board that was told to direct the development of HGPGI. So when this department, that department, what will be the structure, only PGs or only postdoctoral and all that, I says, you do whatever, but one thing, there will be a department of clinical immunology. Rheumatology still, because there was a lot of rheumatology or orthopedics. So I said, okay, start clinical immunology. I will add rheumatology later on, because I remained on the panel of SGPJ for a long time. Then later I told Misra, put rheumatology, and then it became clinical immunology and rheumatology. So I developed a department in All India Institute. When I was not given a separate department, because what happened, I was senior, I was head of the department of medicine. They said, you are already running the whole department of medicine and your clinical immunology is going on so well. Why do you want a separate department? So I said, I am resigning. I am going out. Okay. So I went out for 6 years to Kuwait. I set up the whole department of rheumatology, which is still running there. Yes. And now that is recognized in MRCP, rheumatology subspecialties. Then I came back after 6 years and set up the rheumatology department in Indian Spinal Injury Center, where they gave me the full hand. And I have now the whole rheumatology department along with the laboratory. So this is how I developed these departments. I take pride in saying this suggestion of mine was taken by SGPGI, where you have done your DM. Yes. This is because my suggestion the department has started.
So, sir, out of all this, which was the most challenging for you? Was it
All India Institute? Those were the days when nothing was available. I had to really take my own blood, prepare gamma globulin by precipitation with monosulfate, purify it, inject it in the rabbit, inject it in the goat, bleed them, purify them, conjugate with the fluorescein smuggled in the pocket from America, and then do the immunofluorescence myself. And we were the first one to start anti-nuclear. And we wrote paper after paper. The community survey of lupus done on finger prick anti-nuclear antibody with Graham Hughes.
Published in
That was all homemade anti-nuclear test, the whole kit. We made it in our own laboratory, your room number 4076, which is still there. So this is how the whole thing picked up. And number of PGs who came to me for doing thesis, because they knew, here you go, large number of patients, dermatomyositis, Sjogren syndrome, scleroderma, lupus, rheumatoid, what have you. Ankylosing spondylitis, because by then Narendra Mehra became my colleague. So Ramesh Kumar from microbiology, Bhuiya from pathology, Narendra Mehra from HLA, and myself. This is a teamwork. Really, you can't work in isolation. So this team, we have produced 550 papers. And Mehra and myself, we are still writing papers today.
Okay.
So I will like all the youngsters to pick up something of your interest, learn everything about it. And the American style, you don't leave laboratory to somebody else. If you are a respiratory specialist, laboratory, sleep lab should be under your care. You should be able to interpret it, do it, perform it, examine the patient, treat the patient. This is the way to develop the whole. That's what I have done, and I feel very satisfied. That's okay. Now I am 84 years of age, and yet read a lot. And still know what else to be done. At present, I am involved with prevent premature atherosclerosis in rheumatoid arthritis and lupus. I'm going to present a poster there in next meeting. If any burning question, I'm ready to give you, but this is my life story. My interest, you didn't ask me. I'm interested in many more things.
Yes, I'm coming to that.
Okay.
So, sir, you have developed yourself into a multi-talented, dynamic personality from academics, 550 papers. You are still reading, posting them with your comments, to then going to learn Indian classical music, to Western music, to playing chess, badminton, cricket, swimming, and then doing gardening. So, what is your mantra of success?
There, I would like to bring my better half. She was in Lady Harding and she was going to be a doctor. She has given up all that to support me. And she has been the main force who has backed me without being selfish. She has looked after me. And then she has made it clear, you get involved in whatever suits you, whatever you like, whatever is your passion. She supports me and looks after the home. So I must thank her for everything, whatever I am, because of her. Very close friendship of ours. Singing has been in my family. You will probably know Madan Mohan Malviya himself was a singer. And then it came from my mother's side. My mother was a mohalla bhajan singer with her harmonium all over in Allahabad, in Lucknow, wherever she went. Maji, come, she will go for. So I learned from her, and then I learned the classical music from her. Then I started going to Sangeet Samiti in Allahabad to learn classical. When I was in intermediate, and a music teacher will come, and my father took me aside, decide what do you want to do. You want to be a singer, or you want to be something else? I said, well, that's a very difficult question. No, I will like to do both. He said, no, that will not be possible. Either you excel in one or the second, you can't do both. You decide. And then he gave his advice. He says, singing will probably not fill your stomach. What's your other passion? I know you want to become a doctor. From the age of 2 years, you were giving injections to all your children, colleagues. So you choose. I said, there is no choice. I have to be a doctor. What happens to singing? I said, that I will make my hobby. He said, thank you. And that's it. I left on the spot after intermediate. I didn't take any lesson. I just gave it up. But when I went to Boston, my chief of the medicine department, shorts ke alawa there were many other. He said, "What's your interest, young man?" I said, "My interest is Indian classical music. I know Western classical. You teach me Indian classical, I will teach you Western classical."
Okay.
And he taught me what is symphony, what is sonata, what is chamber music, what is. So, who is Beethoven, who is Mozart, what is the first movement, what is second movement, what's the scale, A scale and C scale, and what is minor and major. I learned Western music understanding from him, and I gave him all what I could from the Western, from the Indian music side, classical singing. Then I used to sing in medical college on this stage till 1985. Lucknow radio station has my recordings, which I did for all the drama. I used to give background music. I used to sing for heroes. So that was my passion, and I kept on doing it. 85, I lost my voice. Since then, I just enjoy listening. Then swimming, being from Allahabad and Sangam in Gangaji, I used to swim. But then I thought that this is not swimming. I got a book by a person who was the Olympic coach for the swimming team of USA.
Okay.
And by then, Ramalinga Swami said, "Anand, you are in sports, you play cricket and badminton. What else should we develop in All India?" So I said, "Sir, swimming pool."
Yes.
So, on my recommendation, he got the clearance, and now behind ICMR there is a swimming pool.
Yes.
My thought, and Rama's okay. So we appointed a Navy diver as the coach, and he took my book and he taught everyone swimming. And I, of course, then I learned the real swimming, but very slowly. And so that was swimming. Badminton, of course, everyone learns. I also learned. But chess, just like that. Bobby Fischer and Karpov, they became so famous all over the place. I said, I must learn chess. So I bought the book, went through the book, all the openings I can tell you, and Caro-Kann defense and Nimzo defense, or I can play chess with you even now. So that's how I went into chess. Then I was given a house in All India Institute, which you will know, D47, the last one.
Yes.
There was so much ground, I said, something has to be done. Talked to my wife, very interested in gardening. So she said, let us develop it into a garden.
Okay.
Later on, Ramalinga Swami came to see, and he brought the team. Look how the piece of land is developed. Learn from Anand Malaviya. So we did 7.5 kilograms of gobi. He came to see that. Pusa se maine seed mangai thi.
Yes.
And then I wrote a manuscript for a book in gardening. Never published it. But, and you can see, yesterday we went to a nursery, bought many gamlas. We are going to put in our farm. So that is how I developed it. But one thing is very clear. When you are involved with one thing, go deep in it and set aside a time for that.
Okay.
For me, reading and being updated in the subject from 4:30 till 7:30, my wife will also not knock on that place. She says, it's your time, you read. Till today, she never disturbs me till 7:30 in the morning. Uske pehle, I will sit in my room, read everything what has come in the morning from all the journal content paper, choose the paper, download quickly, and students like you keep on sending me. If I don't have the access from SGPGI, from AIMS, I say, "Bhai, ye paper I am not getting, please send me," and they send me. Amita still sends me. Durga sending me. I will now bother you also. And my daughter-in-law, who is professor in Harvard Medical School in Boston, she sends me all the things from Harvard Medical School, university's library. So keep slots allotted to. Now my time at 5 o'clock is now my time to go for run.
Okay.
And I do 7 kilometers of running. My wife never stops me for that. My child, my children, they will never say, "Papa, you should be home because I am coming." No. That's the time he goes for his run. So divide your time, be strict about it, follow it, except in emergency. That, like
Yes.
today,
Yes.
probably I will not go for my run, but I can still go. Yeah. So just be very strict in your discipline. Take out times, make slots, and keep doing it, and it becomes part of your daily life. When you don't do it, you get depression. That I haven't read for the last 2 days, that's wrong. I haven't done my run for 2 days, this cannot go on like that. Just like that. This is what we do.
So once you have been into clinical immunology, once you came to India, you also got associated with Indian Immunology Society. How did that happen? And that a clinical immunologist is getting associated with basic immunology.
Professor G.P. Talwar. In All India Institute, I will name K.L. I already mentioned.
Yes.
One of the top physicians who used to treat presidents and prime minister. Legend in medicine in those days. Then MMS Ahuja, who followed in his steps, greatest endocrinologist of those days. Then we have G.P. Talwar, probably the biggest brain after Ramalinga Swami. Ramalinga Swami here, till today he is being quoted, his sayings and his lectures are quoted in journals, who became chief of ICMR later.
Yes.
Genius. MPhil and PhD from Oxford. He was the director when Vic Saab retired, and he was almost my mentor. Now, when you have such people in the area, and G.P. Talwar, I must mention, he is a basic scientist,
Yes.
basic biochemist. His IQ, I think, was one of the greatest, biggest IQ I have known. He is 95 years of age.
Yes.
And is still going strong. He says, Anand, you are from Boston. I'm an immunologist. I say, I'm also an immunologist. He says, come over. And since likes his son, he just took me just like that. So I must say, Manmohan Singh Ahuja, Ramalinga Swami, G.P. Talwar, in microbiology, Mahapatra, who was my inspirational guru, Ramesh Kumar from that, they guided me to become what I am. And G.P. Talwar said, Anand, let us make a society of immunology. I will tell you basic, you will tell me clinical, and this will become a famous place. That's how I was the second president, because he was the first president.
Yes.
Then Immunology Society, Mehra joined it, then it became an Asia Pacific Society.
Yes.
So I served in immunology, I served in Bombay, M.M. Desai. Gave his name, who started rheumatology. Bombay people started rheumatology. Delhi people got very, they are starting, we must have it. K.L. Vick thought about it. And then came Hari Vaishnav. My senior from Lucknow, KG Medical College, who was head of medicine at Maulana Azad. He says, Bombay people will be ahead of us. Let us immediately create a society, Delhi Rheumatology Association. Vick Saab, Vaishnav, and Vaishnav's 3-4 chela, and Vick Saab picked me, Anand Malaviya, and we started it here. Then we became friends with Bombay people, and those days, because M.M. Desai was a cardiologist. So for them, it was all rheumatic fever. I said, come on, rheumatic fever is not immunology, rheumatology. We will do the real rheumatology and immunology. That's how Indian Immunology Society, I served secretary, vice president, president. But later on, when I went abroad, I lost touch. But recently they called me and gave me the Lifetime Achievement Award and all that. And now it is being held after 50 years in All India Institute. I hope they will invite me for a talk.
So, sir, you have been mentors to so many students, and to name a few of them,
To
you
be
have also-
lucky.
So,
On top is Ramraj Singh, who is
yes,
tenure professor at UCLA in Los Angeles. Then, of course, Ramnath Mishra. Then Ashok Kumar, who was professor, and now he's heading the director of all the Fortis Hospital. Ira Pandey, rheumatologist is there. Bhaskar Dasgupta. Now they call him father of giant cell arteritis, who has changed the whole triaging of the patients of giant cell arteritis.
Yes.
I'm proud to say he's my student. He learned rheumatology from me and wrote the first real detailed paper on psoriatic arthritis. They didn't quote his paper today. I was very angry. That was the first real extensive paper, Bhaskar Dasgupta. Of course, I have many more.
Yes.
Banerjee and many PhDs, Prema and Khare and others. and Sanjeev Prakash, who gave the undifferentiated spondyloarthritis first time in India, in the world, and then many others. Amita Agarwal, of course, one of them.
So, what is the art of successful mentoring? You talk so much about students and
I guess
they have done.
passion that I got from my father. Teaching is my passion. You make me stand somewhere on the road, I will start teaching. If somebody asks me how to prevent death on crossing the road, I will teach them what is the chances of you dying or not dying while crossing the road. This has come from my father. He was a great teacher. He was in education department and he started as a degree college teacher. That is gene. Teaching is an art. Many people know all, but they are not very good teachers. For example, when I was in AIMS, and now you will be having many Nobel laureates who will be coming giving a talk. Hargobind Khurana was called when he got the Nobel Prize for Helix. Well, he gave talk, everyone was sleeping. Yeah. He was such a poor speaker. When he finished, then in the laboratory I taught everyone what is double helix. Now I understand what is double helix, So teaching is Saraswati Ma ki kripa. She gives it and it has to be inbuilt. There are some good teachers and not so good teachers. That fortunately my parents gave me. So, and I do one other thing. Students are not my junior. They are my colleague. Till today, the other day, Ish Bhatia was here and he said, sir, we consider you as our friend and we will go and talk all kind of things with you. You were so relaxed. So this is one approach which I think youngsters should take if they want to grow themselves. The book by Haley, actually when you support others, you grow.
Yes.
So all my students are me. I can see myself there. So it's selfish to be good to my students. No, I'm growing. These are some of my philosophies. But in the background is my wife. If she would not support me and keep on asking me why this, why that, why you are so poor, why you don't practice in All India Institute, hand to mouth, I had to borrow money to send my children to college. My father-in-law often supported for buying their shoes. The salary there, I was head of the department of AIMS. 11,000 rupees. 11,000. So, and yet happy.
Yes.
Doing research, teaching. These are some of the things you learn and grow, and at the end you feel very happy that you have done it.
So, sir, young rheumatologists are there now. India has a very vibrant rheumatology society, and we have new students, new people who are joining the society every year. What's your advice for them? And if they want to choose between a government job versus a private practice versus a corporate practice, what should be the...
Excellent question. Excellent question. I keep on telling my fellows when they come to me and when I was running the DM, from first day, tell me what is your aim. Do you want to become a teacher in a medical college? Do you want to go for a research scientist position? Or you want to go and become a rheumatologist in the community to serve the population? You decide that. I will give you training accordingly. And this decision has to be done by the candidate. And at this level, when I started getting people who came to me, I said, you go and practice. You are very good with patients, but I can see you can't think in a structured way to go for research. One of them, she came and she says, I will do research. I said, you do this. First, you go and learn statistics and then you learn Excel sheet and produce papers. Then I gave them what to do. And right now I have two persons. One from a particular state and the other from a particular state. The one from one of the west part of India, she says, I will do research. I gave her my this EMR, open it and just download all the information from that. And she has made a paper which will be presented in IRA. The other one, Saab, I will go to my state and run a nice practice. Now I know how to use methotrexate and how to eat rheumatoid. One other thing, if you want to go in practice, be a master of one disease, the rest will follow. He has become real good diagnosis man and treating doctor for rheumatoid arthritis. The rest he knows, but he is going to be a famous practitioner in his state. So this depends on the candidate who comes to me. And they have to talk to me what's their interest. I will guide them accordingly. That's how I go.
So, with this, sir, we would like to conclude today's episode, and we thank you for all your time and sharing your experience
I
and
will,
stories.
I would like to first thank you and Dr. Akerkar for giving time. And I would like to thank Indian Rheumatology Association and especially Professor Dharmanand who thought about it, because often we felt that we have done this, and poor late Dr. Devudar is not there. His story should some of his students tell. He was also one of the stalwarts. Of course, we are Joshi and Chandrasekharan, myself and Dr. Professor Mukherjee. What we have done when there was nothing here, and if it goes and others listen to it and learn something, we will feel that we have been successful in whatever we tried to achieve has been achieved to some extent. I thank the Indian Rheumatology and both of you for giving me time. Thank you.
Thank you very much. We also have the privilege of having some of Sir's students with us who are joining us from remote locations, who had trained under Sir and share their stories and experiences while they were being trained by him at All India Institute. We will listen to their stories now.
Hello, friends. I'm Rohini Handa, consultant rheumatologist at the Apollo Hospitals, New Delhi. I was earlier professor of medicine at the All India Institute of Medical Sciences, New Delhi. I'm recording this video for the Indian Rheumatology Association, and it's a proud privilege to have been asked to speak about my mentor, Professor Anand Malaviya. I first came in his contact in 1987 when I joined his unit as senior resident, and there are some instances that stand out vividly in my memory. As senior residents, you could set your watch according to his punctuality. Morning rounds meant 9:30, evening rounds started at 6:30 p.m. sharp, and if Professor Malviya was running late for any reason, I still remember that he would call up the ward, inform the staff in D2 that he was running late. This was extremely unusual. A senior consultant calling up the residents to let them know that he is late by 5 minutes or 10 minutes. And this is something that I can never forget. His consideration towards his junior staff. The second thing that stands out in my memory is that after the clinic was over, he would pick up an X-ray requisition form. And in those days, we had those yellow requisition forms at AIMS. And on the back side, he would explain to you the nitty-gritty. So if it was paniculitis, paniculitis with vasculitis, without vasculitis, nodular, lobular, and he made things so easy that one was actually enthused and infused with the love for specialty. For many of us, this was our first exposure to rheumatology, and he made it sound so simple. He was a born teacher. He is a born teacher. And the third incident that I would like to share is that when I had joined the faculty, this was 1992, 1993. In those days, we had 12 postgraduate students in the Department of Medicine. They were free to choose their own thesis guide. and the overwhelming majority opted for Professor Malviya. As assistant professors, nobody would come to us. So one day, the three of us, we were three assistant professors in the department, walked up to his office. Randeep Guleria, Kalpana Nagarkar, and myself. He was working on his computer, turned around in his swivel chair. Tino Ayo. There must be something wrong. He patiently listened to us. We told him that we had no postgraduate students and we were finding it difficult to carry out research. Without hesitation, he said, I think, yes, we should have the postgraduates join all the faculty members in the department. He immediately set up a committee under Professor Vinod Kumar, who was professor of Unit 2, and we had the postgraduates being allocated to the junior most faculty member, a practice which is now, uh, it's still now followed at AIMS New Delhi. So that was Professor Malviya for you. Very democratic, very open, and accessible to all. I can only end by saying that I was very fortunate to have him as my teacher, my guru, and I would like to thank him for introducing me to and teaching me rheumatology. God bless you, sir. Thank you very much.
Professor Malviya has been mentor to a whole community of students, including myself. However, there is a distinction which only I can claim, and that is my association with him is by far the longest. I had the chance to meet Professor Malviya for the first time during the student faculty meeting that took place in the August of 1973 when I joined the MBBS course at AIMS. His dynamic and affable personality and melodious voice left an indelible imprint on my mind and obviously contributed to my choice of him as my mentor in the long term when the time came to exercise this choice. Professor Malviya guided me, trained me in various stages, like I was a undergraduate student first, became a junior resident in the Department of Medicine, then got posted as senior resident in the Division of Rheumatology later on, and also I had the chance to work as a senior research associate with him. It was actually great to see him teaching on the bedside. He was a wonderful teacher. His passion for punctuality was so much that once he remarked, if I don't appear at 9 o'clock for the ward rounds in the morning, there are only two possibilities. Either I'm not coming or I'm dead. His passion for teaching is evident in his Zoom lectures, in his Google Group communications, and in his talks and interactions in various conferences. In 1980, when it was early time for hybridoma technology, in one of the journal clubs he remarked that monoclonal antibodies, I'm sure, are going to come in a big way in the therapeutics of autoimmune diseases. And it took 20 years before this was realized, but he had the courage and conviction to make this statement at that time. Undoubtedly, he was the most sought after postgraduate thesis guide in his heydays. Now, besides this, I have observed him very closely regarding his multifaceted personality. He was a great cricket player, a great swimmer, and a great musician, a vocalist, in fact. He was and remains a strong proponent of physical exercise. Another important part was the dinner parties that he used to host for the residents and other junior faculty. And this actually afforded an opportunity to his students to develop a special bonding with him, which would last lifelong, and they would remain connected with him for many, many years to come. Lastly, I must say I had the great fortune of working as the first junior faculty colleague with him in the division of clinical immunology and rheumatology. I remember an instance when I was very keen to attend a conference in London, and this would have been my first trip abroad. And I had made all the arrangements for funding, etc., from Department of Science and Technology. And when I sought his permission, he said only one of us can go because the work of department must not suffer. And at that time, there was no third faculty member. Before I could express my disappointment, he had already made up his mind. He said, Ashok, don't worry. I will stay back, you go. So that was his kind sort of attitude towards his juniors. I think I have been very fortunate to be associated with him for such a long time, and I continue to do so. And Professor Malaviya remains a great source of inspiration to scores of his students across the globe. Long live Professor Malaviya.
This is Ramnath Mishra. It's a pleasure to recollect my initial days of training under Professor N. Malaviya, Division of Clinical Immunology, Department of Medicine, All India Institute of Medical Science, New Delhi. I joined in May of 1982 as an ICMR talent search scholar, or research officer, and was there till January of 1986, when I moved to UK as a recipient of the Arthritis Research Council Fellow under Sir Professor Ravinder Maini. My training in clinical immunology under Professor Malaviya consisted of clinical exposure to patients with rheumatic disease and laboratory experience with autoantibodies. It was Professor Malaviya's dynamic and persistent effort that I am privileged to have. Professor Malaviya used to read ANA and took me along, and another research scholar who was with me. We prepared the slides of HEP2, growing the HEP2 cells, and I also learned culture technique to culture Crithidia lucili. Professor Malaviya used to attach me with the Department of Microbiology and Biochemistry, Professor Ramesh Kumar and Professor Chiplunkar. It is under the guidance of Professor Malaviya that I learnt my ELISA and I standardized antibodies to single-strand DNA. those days ELISA were different, unlike the one that we do today with kids. This is a kind of, we used to add individual reagent to the ELISA plate, and therefore the flexibility was there. I owe my lab foundation to Professor Malviya, who is a great teacher. His understanding of immunology was very clear. He's a masterly teacher, and he took every day care to learn what we learn in the lab and provided all the necessary equipments and consumable for me to train. I'm very grateful to remember these days. Had it not been for this training, the basic and the laboratory component of my information in clinical immunology would have been grossly inadequate. Thank you.